Hello and welcome to another episode of In Your Neighborhood. I'm your host, Jennifer Wakeman. Our first stop this evening takes us to Kulpmont, where Geisinger is offering an innovative solution to elder care. Making the decision about how best to care for an aging family member can be difficult. Many seniors want to stay in their homes but require physical assistance to get through their day. A model of care developed in the 70s has proven so successful that Medicare deemed it a permanent provider, and now that program has come to our region.
Model of care is, of course, the program is called Life Geisinger, but it's modeled after a national model called PACE, which stands for Programs for All-Inclusive Care of the Elderly. And the acronyms get kind of lost, but PACE in Pennsylvania, people immediately think of the drug plan for seniors. So that's why in Pennsylvania we call it Life. It actually began in the 1970s out in San Francisco, California. There was a dentist and a social worker who created the model. They were caring for a Cantonese population who really wanted to stay in their community rather than go into a nursing home. So to do that, they brought together an interdisciplinary team, and what I mean by that is a physician, a nurse, a social worker, a variety of professionals like we have here at our center to provide care in the community rather than in an institution.
The outcomes of the program were better health care and socialization for the participants while still being able to stay in their homes.
Geisinger got involved in this back in about 2002, 2003, where a senior leader actually went to a healthcare conference, heard about this really innovative model of care and said, you know, I think that's something that we should look into doing. So I partnered with this executive and created a business plan looking at the model. And to that point, PACE had only really been done in very urban settings. It's been done in Pennsylvania, Philadelphia, and Pittsburgh, but in this big narrow area in between, there really was not the opportunity for rural seniors, especially to have this type of care model. So we said, you know, let's give it a try.
Based on demographics and census information, Geisinger found 9 counties in Pennsylvania where they felt the model would be feasible. In January 2006, they opened Life Geisinger in Scranton with the goal of creating 5 sites across north central Pennsylvania. As one of 14 groups across the country to receive a grant from Medicare for expansion, Life Geisinger opened in Kulpmont in January 2008. The facility incorporates all aspects of healthcare for the participants.
We have a lot of fun here. We have a lot of activities that we have planned for the participants. We have a lot of groups. We have exercise groups. We have entertainment that is brought in to entertain our participants. We take day trips. We've been to Knoebels. We've been a lot of other places. We have them go in our vans to these day trips, and they really love that. Aside from that, like I said, we do all the therapy here. We do all the rehab on site. We have a full medical clinic within our center as well. When they get enrolled in the program, we are fully responsible for all their health care through the program.
A nurse practitioner and doctor are on site every day along with RNs and LPNs to see to each participant's medical needs. In addition, physical and occupational therapists assist members in strengthening and staying as physically active as they can be. While it is a group day health program, care and treatment is individualized for each participant.
There is a plan of care that's developed for every individual that we look at and that will potentially be enrolled in the program. The family has to review that plan, actually sign off on the plan as well as we do. So as long as both parties are holding up their end of the bargain, that is really the best health care for that individual.
The Kulpmont facility currently has 48 people enrolled and is licensed for 82. Once Geisinger is contacted either by a physician or a family member about possible enrollment, an intake nurse visits the family and does an evaluation. Based on her recommendation, the Area Agency on Aging is then called in for its opinion. If they feel the individual requires a nursing home level of care but can be safe in their home while not at Life, then the participant is enrolled in the program. In-home aides are also available if it is deemed necessary to help get a participant up and dressed in the morning or to bed at night. Medicare and medical assistance cover the cost of the Life program, further reducing the burden on families. The building that houses Life Geisinger in Kulpmont is the former Kulpmont Elementary School.
It's a beautiful building, very quaint. And one thing you'll know about the program is to know one PACE site is to know one PACE site because they're very unique to the community. This building was actually an elementary school, and the Northumberland County Housing Authority purchased it And it's, many of the small community-based elementary schools are kind of turning over. They're making larger schools. So when they purchased it, they actually, I forget how much they paid for it, but they had long-range plans to expand the building. They actually took a portion of it and developed independent senior living. So there's 22 apartments that are not owned and operated by Geisinger. Again, that's done by the Housing Authority. Luzerne Community College actually has an RN outreach program. So there are non-traditional students, LPNs and otherwise, that are taking night classes, some classes during the day to move to an RN status, which is great because there's such a need. And then there was this huge vacant gymnasium and cafeteria in the building that had sat, vacant for many, many years. And they knew that they wanted to expand, but just not sure what. Well, it's perfect. I mean, it's perfect for what we wanted to do.
An addition was made to the gymnasium to complete the life facility. Before we completed our visit, we were introduced to one participant with a very special relationship to the building. Rita Bolesta taught 4th grade and then became principal of Kulpmont Elementary. The time she spends each week at the Life Geisinger Center is very special to her.
I taught first. I took up the elementary, and I taught there first, and then I was made this principal. And then, of course, I went on, and I loved it.
Yeah.
I loved it. And it was amazing when I sat down and thought how beautiful it was that I was here so long, And I just had to tell everybody how long I was here.
The goal of Life Geisinger is to support the caregiver and the family just as much as the individual. I asked Director Amy Minich if they could see changes in the participants since their opening last year.
I think the best example I can give you, when people come into the program, we take a picture because we have to have identification just for safety reasons. And then we look at those same individuals 3 months later. Many of these participants are asking to have their picture retaken because they don't even look like the same person. Truly, it's remarkable. The accolades that we get from family and caregivers, like, my mom is back. Like, she's a different person, and it just makes you feel good.
Life Geisinger gets ringing endorsements from its participants as well. It seems like a really neat program.
It is. It is. I would advise it to anybody.
Would you?
Oh, yes.
If you would like more information about Life Geisinger, you can contact them at 866-230-6465 or visit them on the web at lifegeisinger.org. Coming up next, we'll introduce you to a Danville wood sculptor, and I'm going to learn to kayak. You're not going to want to miss it, so stick around.